Coronaviruses are a family of viruses that can cause illnesses, such as the common cold, severe acute respiratory syndrome, SARS, and Middle East respiratory syndrome, MERS. It can affect your upper respiratory tract or lower respiratory tract. In early 2020, after a December 2019 outbreak in China, the World Health Organization identified SARS-CoV-2 as a new type of coronavirus. The outbreak quickly spread around the world. In March 2020, the World Health Organization declared the COVID-19 outbreak a pandemic. COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. The most common are fever, dry cough, and tiredness. Other symptoms include shortness or difficulty breathing, muscle aches, chills, sore throat, headache, or chest pain. But COVID-19 can also have symptoms you might not expect. Here are the 5 unusual symptoms of COVID-19. 1. Loss of smell or taste, which doctors call anosmia. As the novel coronavirus, COVID-19 continues to spread, many patients are reporting a loss of sense of smell and sometimes taste is a symptom. As many as 85% to 88% of patients in a study recently accepted to the European Archives of Oto-Rhino-Laryngology reported smell and taste dysfunctions in mild to moderate cases of COVID-19. 2. Conjunctivitis is the medical name for pinkeye. Based on data so far, doctors believe that 1% to 3% of people with COVID-19 will get conjunctivitis. It happens when the virus infects a tissue called conjunctiva, which covers the white part of your eye or the inside of your eyelids. Symptoms include if your eyes are red, swollen, itchy. Although conjunctivitis is a rare manifestation of this disease, we should take all the necessary precautions to prevent conjunctivitis, including frequent hand washing, avoiding touching their eyes and face, and using glasses instead of contact lenses during the coronavirus outbreak. 3. Multisystem inflammatory syndrome in children. On May 4th, the New York City Health Department issued a warning that 15 children in the city between the ages of 2 and 15 years have been hospitalized with multisystem inflammatory syndrome, which officials said is potentially linked to COVID-19. There have been reports of similar illnesses among children in Europe who also tested positive for COVID-19. Clinicians describe the symptoms as similar to toxic shock syndrome, or Kawasaki disease. Symptoms include red eyes, rashes, and a swollen tongue with reddened lips, often termed strawberry tongue, and an inflamed blood vessel system all over the body. There is constant high fever for at least 5 days. The disease also affects coronary functions in the heart. MIS-C is now believed to have impacted approximately 300 U.S. children. The number could be higher if cases in Italy, Britain, and elsewhere were to be accounted for. 4. Covetous. A red or purple rash resembling frostbite or chilblains are also known as pernia-like or pernosis. People with pernia may get skin bumps, redness, and swelling on their toes and fingers. Because of inflammation in the small blood vessels of the skin, this happened after exposure to cold air. Doctors in Europe noticed that these pernia-like lesions and red bumps were starting to show up on the toes and sometimes hands of certain people who tested positive for COVID-19, particularly in younger and otherwise healthy adults. People may have painful, burning, or itchy bumps or a rash on their toes that can last for a week, though some unlucky patients can experience it for up to 3 to 4 weeks. Experts say when covetous reactions appear in coronavirus-infected patients is one of many mysteries. 5. Silent hypoxia. An emergency doctor working in New York City said that he has seen COVID-19 patients with alarmingly low oxygen levels, but no shortness of breath. He describes this as silent hypoxia. These patients had oxygen saturation levels as low as 50%, when normal levels are usually 94 to 100% at sea level. In patients with silent hypoxia, the amount of oxygen carried in our blood, otherwise known as blood oxygen level, is lower than expected compared to the other vital signs. Silent hypoxia is not usually an early symptom to occur in COVID-19 patients. They frequently arrived at the emergency room for other reasons, such as muscle aches, fatigue, fever, and cough. Typically, when a patient begins to demonstrate silent hypoxia, they already have other COVID-19 symptoms and may be in critical condition. The best way to prevent illness is to avoid being exposed to this virus. Practice protective measures. Still the best way to protect oneself against COVID-19. Stop the spreading of virus. Stay at home. Please don't forget to subscribe and hit the notification bell for more updates. Thank you for watching.